suggest that we now move straight into our agenda for today. Let us have a look at a short video that will bring it is in the right mood for our agenda item on primary health care. Are we ready with the video?
As COVID-19 cases surged across the globe, primary healthcare continued to provide essential services while supporting the pandemic response itself. The pandemic has upended our world and challenged everything we believe in, but we also have learned a lot. Many countries in the WHO European region have transformed primary healthcare and accelerated long-standing reforms. In Kazakhstan, multidisciplinary primary healthcare teams include psychologists and social workers. They provide comprehensive support not just for physical health issues, but also for mental health and social needs. Victoria Shalomova, primary school teacher, suffers from Guillain-Barré syndrome.
Я когда получила инвалидность. Я не ощущала этой разлуки, потому что мы общаемся онлайн и видимся, и видим друг друга.
The expansion of digital services has transformed primary healthcare forever. Remote primary healthcare consultations in Lithuania, like in many countries, helped maintain access to essential health services, but have also shown the need for a systematic approach, one where policy and legislative support, managerial leadership, adjustment of teamwork, and continued investment in digital health literacy all come together.
In national level, huge investment should be done to keep e-health platforms to run very smoothly, and I think all the teleconsultation system should be easy, acceptable, and adapted for the patient and for society need.
Most importantly, the pandemic has challenged us to act better on our principles of solidarity, to identify and reach the vulnerable in our communities in real time.
We know the health inequality gap is increasing, but despite all of our best efforts, in certain cases, some patients are still slipping through the net. Finding and supporting these patients can help them improve their lifestyle and their overall health for years to come. Some groups of patients aren't responding to our standard one-size-fits-all approach to support them to improve their health and lifestyles. We have the analyst support to be able to interrogate the data we now have available to really pin down which groups we need to support better. For me as a GP, this offers a way of providing a different service that is tailored to our patients that we know will work.
None of this would have been possible without the commitment and sacrifice of the health workforce. Supporting their health and well-being remains a key priority and investment.
One of the things that we always look at a national level is with staff working from home, we actually have very significant responsibilities on a legislative level to support their well-being needs. The scale of what was being asked of primary healthcare workers and other healthcare workers, and that how critical it was for management and leadership to acknowledge that, giving people the tools that they need to do their work, to do their day-to-day job, making sure that they have the equipment that they need, and how critical that is. Managers are given the training and the soft skills training to enable them to support staff in the workplace.
It's essential for all of us to learn lessons and even gain inspiration from this pandemic, so that we can turn these lessons into strategic actions for stronger primary health care, for more resilient health systems, for economic and social recovery, and ultimately for the health and well-being of our people.
Well, I hope this video you just saw on primary care will get us started in the right spirit. Those smiles at the end of the film give us optimism for the future. And indeed, let us consider that the key trends in primary healthcare transformation during the pandemic and our opportunity to realize its potential. We are indeed starting the day in high spirit with a very important session on realizing the potential of primary health care, lessons learned from the COVID-19 pandemic and implication for future direction in WHO European region. I believe this is a topic close to all our hearts and a matter of great importance to our citizens. We have all expressed commitments in the Alma-Ata and Astana declarations, and we are working hard to implement them. The pandemic has magnified the importance of our commitments, and I believe I speak on behalf of all of us that we greatly appreciate that WHO has put this topic on the agenda of this session on the Regional Committee. The session is a busy one with a keynote presentation, a high-level panel, open discussion and adoption of the proposed resolution. I will introduce this in order as we go through the program. The relevant documents for these agenda items are on the screen. Let us consider the key trends in primary healthcare transformation during the pandemic and our opportunities to realize its potential. I invite Dr. Natasha Zopardi-Muscat, Director of Country Health Policies and Systems in the WHO Regional Office for Europe, for her presentation. And I hand over the management of list of speakers to Executive President. Thank you.
Thank you very much, Madam Chair. Good morning, good afternoon, and it's my pleasure to briefly run through the key trends that have emerged during the pandemic. So, starting off, we have heard from all of you about the importance of primary healthcare. Primary healthcare is the entry point to our health services. Primary healthcare links the services to hospitals, to specialized care, to mental health and long-term care. And a strong primary healthcare system is the backbone for resilient health systems. So moving to the first trend, during the COVID-19 pandemic, we have seen how primary healthcare has really enabled a dual-track response. On the one hand, our primary healthcare services were monitoring the COVID in the community, surveying, contact tracing, and of course, they were also indispensable for the delivery of the COVID vaccination. On the other hand, however, they were responsible for maintaining essential health services. This flexibility, this ability to surge, to respond, to play a dual role in an emergency is something we need to build into our health system's resilience going forward. Moving now to the second trend. The second trend, as we have heard many of you saying, is that multi-platform primary healthcare is here to stay. Of course, this means that we need to continue with face-to-face delivery where this is needed. We also complement this with delivery through mobile units and platforms. And what is new is that today we can also offer remote delivery. What is key is to recognize which modality is needed for which patient at which point in time. There are opportunities. The opportunities are that this enables us to take our services farther and closer to people. It also allows our primary healthcare providers at the touch of a button to be linked to expert centers. And it also integrates physically distant services. But we also must be aware of the limitations and of the challenges. These include the digital literacy of providers and users, which may be limited, the lack of trust unless we ensure that there is a strict architecture and confidence in the confidentiality and privacy, particularly of sensitive health data, and the importance of recognizing that most of our health service users are often the people who are least able to access the digital transformations, perhaps the elderly, those with low levels of education, or also those living in areas where infrastructure is simply not available. And therefore, moving now to the third trend, we really need to make sure that we leave no one behind. And during the pandemic, we have seen just how important primary healthcare is to serve the needs of the vulnerable. We have heard also in the video that this requires that we have a clear overview of our population health needs, that we use our data to recognize those persons who are not availing themselves of our services, and that we reach out proactively, that we provide comprehensive psychosocial support services, that relying on the biomedical model of provision is simply not enough. And that we also acknowledge that in order to do so and to deliver these services, we need to work in partnership, because we can't do it all alone. And coming now to the fourth trend, this is, of course, about the workforce. A strong primary healthcare system depends on having a strong primary healthcare workforce. We need to ensure that we attract and retain the best. We need to make sure that primary healthcare services really focus also on meeting the mental and social needs. We heard yesterday from our regional director the call to embrace task shifting. Let us go beyond task shifting and also look at task sharing. And this is why this image is so close to my heart. Of course, every country, every context will have its own type of multidisciplinary team, but the key point to emphasize here is the interlocking nature. We make a whole by bringing our services together. And this also enables us to share resources, because primary healthcare in the 21st century also requires the backing of the right resources. How do we know this? We know this because we have learned from you through our health system response monitor in collaboration with the European Observatory on Health Systems and Policies, through a wonderful series of country vignettes that are available on our website that provide quick bedtime reading, through the member state consultations, and through your active participation in the talk shows, for which we are immensely grateful. What do we need to do next? My first ask is that we invest in and protect the primary healthcare workforce, attracting and retaining the best. This means that we need to look at the future needs. We need to look carefully at our education and training programs, and here WHO is working also very closely with Amy to ensure that primary healthcare, the digital skills are covered, to ensure that primary healthcare workforce has a decent pay, conditions of work, and that we offer health and well-being support. Because working in primary healthcare in the community can often be very lonely, and one can feel very isolated. The next ask is that we continue to invest in digital solutions to strengthen primary healthcare, using shared electronic health records, building telehealth and telemedicine solutions, and also encouraging people to be able to use people-facing management tools. Coming to the third ask, this is about resourcing primary healthcare transformation. And I'm delighted to see that many countries are really using the funding that is made available as part of the recovery process, having developed the economic case for investing in primary healthcare to prioritize investment in facilities and services, and to make sure that resources are allocated in line with needs. And finally, this requires that we invest in leadership for primary healthcare transformation. I have no doubt from what we have heard yesterday and this morning that there is a strong political commitment. But this needs to translate at all levels, and we need to make sure that we continue to build the partnerships and to invest in the leadership, governance, and managerial skills. So, looking forward, our program for the next 2 years really as our regional director said yesterday, has placed primary healthcare as the flagship of all flagships, really building to support the delivery across the three pillars, moving not just from ensuring universal health coverage, but we saw also from your interventions the role of primary healthcare in preparedness and response, and also undoubtedly if we want to improve health and well-being, and primary healthcare is an anchorage point for the four flagships. So you have heard from me, and now it is time to hear from you. So I invite you to take your phones or use your computers to go to www.menti.com, to scan the QR code or to use the code that you see there on the screen, 34150610, and we have put a number of opportunities that we see to accelerate strengthening of primary healthcare. But please rank them, give us your feedback, and we will come back to you shortly after having listened to you. Thank you very much, and back to you, Madam Chair.
Thank you, Dr. Azzopardi-Muscat, for this inspiring presentation. I am sure my colleagues are eagerly waiting for the open discussion session to reflect and share their experiences. I would like to invite Dr. Anna Stavdal, Vice President of Wonka Europe, to reflect on the main trends on future directions outlined by the Secretariat.
Good morning, and thank you for the opportunity to report from the field on behalf of the primary care workforce. The pandemic works as a magnifying glass and makes pre-existing gaps in health and social services more visible, gaps which have grown wider with COVID-19. Strengthening primary care can contribute to bridging these gaps through qualified, community-based, multidisciplinary teams. First, scientific evidence shows that continuity of care improves health outcomes and reduces mortality of all causes of death. Distrust in authorities' recommendations is a challenge in this pandemic. Primary care workers can be effective agents for health promotion and implementation of public health measures simply because we hold people's trust. Second, primary care, and family medicine in particular, is comprehensive, person-centered, and not disease-oriented, which is different from the fragmented approach in specialized care. How can we use primary care then to mend the negative impact of the pandemic and keep ourselves in readiness for the next health crisis? The collateral damage of COVID-19 is the same everywhere and shows us that medical and living conditions must be addressed as equally important elements. There is no use in treating the wounds of a battered woman if she is not provided shelter. An unemployed person with diabetes is not sufficiently helped merely by good dietary advice and monitoring of blood glucose levels if they lack the income to support themselves and their family. In a crisis, the health of women and newborns is always in jeopardy because women tend to prioritize others' needs before their own, taking care of the sick and the elderly, because the social services for these groups tend to shut down. These are just a few examples to explain the need to bridge the gap between health and social care. To conclude, a few words about the workforce itself. Most of the health workforce consists of women. Bridging the gap between health and social care also implies support to the frontline workers. Increasing the number of professionals doesn't help if there is a lack of recognition, psychosocial support, and security nets around the service providers. The best support is to provide training for and in the primary care setting, which requires long-term planning and commitment. Thank you very much.
Thank you, Dr. Stavdal, for your valuable thoughts. Social and healthcare integration is really crucial for good primary healthcare as well as essential public health functions. I swiftly move us forward in our session to the high-level panel to hear reflections and country experiences. And after the high-level panel, we will then have a pause. I now have the honor to welcome and invite to the panel Dr. Søren Brostrøm, Director General of the Danish Health Authority, Denmark, Dr. Athanasios Plevris, Minister of Health of Greece, Dr. Alexei Tsoi, Minister of Health of Kazakhstan, Dr. Janet Poklukar, Minister of Health of Slovenia. For moderation of the high-level panel, I pass the floor to Dr. Melita Jakab, Head of the EHO, European Center for Primary Healthcare, hosted in Almaty, Kazakhstan. Melita Jakab, the floor is yours. We can't hear you.
Thank you, Chair. It is a great honor for me to moderate this panel and learn from the exciting experience of these four countries. To begin our discussion, let us consider the results of the poll that we launched earlier. And I'm asking the team to pull up the results. And while they do that, I can see on my screen that about 60 of you voted on these important opportunities to strengthen primary healthcare in the coming decade. As the team is pulling up the results, I can already see that you have all considered that these 8 opportunities are equally powerful to strengthen primary healthcare. But first among equals is enhancing prestige, investing in multidisciplinary teams, networks, and integration, digital solutions, and funding. With these results in mind, I would now like to turn to the panel, and let us start with Slovenia. Slovenia invested intensively prior to the pandemic to the integration and coordination of public health and primary healthcare services to be able to address social determinants of health at primary healthcare level. How did this help the pandemic response and establishing a dual track response, as Natasha spoke about in her presentation? What opportunities and challenges you see in this direction for the future? Minister Poklukar, the floor is yours.
Thank you for the floor, Melita. It's true that Slovenia has a long tradition of strong collaboration between primary healthcare and public health. One of the biggest challenges for our health system in the past was addressing health inequalities, particularly for non-communicable diseases in vulnerable groups. This led us to develop health promotion centers that offer preventive and health promotion services in a population. They are based within primary healthcare centers with multidisciplinary teams and strong links to local community and social services. Based on the increasing needs of mental health services because of pandemic, this also led us to develop centers for mental health. They are at community level, and some are for specialized for children and others for adults. During epidemic, on one hand, public health provided field epidemiology, population level health promotion and disease prevention, and also laboratory services. And on the other hand, primary healthcare centers are crucial to help us and make a response to epidemic, because on the national level, they individualize patient management and also by organizing testing and vaccination. having preventive and health promotion services was a great opportunity for us in the primary healthcare centers in the time of pandemic, because it has enabled us to quickly ensure dual track approach across the country. Maybe I explained this a little bit punctually. So this ensures separate pathways for COVID-19 and non-COVID-19 patients. So we organize special ambulatory COVID-19 primary healthcare clinics within community health centers, because we have infrastructure and human resources. Also, in the time of pandemic, was very important that we had multidisciplinary teams. They are experienced in addressing special needs of a vulnerable population, and this was an important advantage when we focused with pandemic. In short, our community-based health centers with strong multidisciplinary teams enabled us to ensure quick adaptation of service delivery in response to increasing needs because of crisis. As a result, hospital capacities were saved for more severe and critically ill COVID-19 patients. With other words, primary healthcare system was a buffer between primary and secondary healthcare system, and this was our big luck in the time of pandemic. So we win this fight with coronavirus. Thank you.
Thank you very much, Minister Poklukar. I believe the experience of Slovenia shows very strongly that the integration of prevention, health promotion in primary healthcare helps with a pandemic response, but it's also what we need for the 21st century disease burden led by NCDs. Now, staying a little bit with this topic, I would like to consider a very important issue raised in Natasha's presentation, which is bridging access gaps during the pandemic through mobile and digital technologies. Kazakhstan is a regional and global leader in this area, and they have built on their pre-pandemic efforts to put in place multidisciplinary teams, as you saw in the video. Minister Tsoi, I would like to invite you to take the floor and narrate your experience for us a little bit, as well as to identify what have been the key success factors for Kazakhstan to close and bridge access gaps.
Conditions, Kazakhstan has adopted the healthcare system, including PHC, and took measures to strengthen it to deliver services more efficiently. We widely use mobile and digital technologies to combat the pandemic. We have developed and widely implemented the mobile application Ashok that allows to determine citizens' epidemiological status, and electronic vaccination passport that has already been recognized by a number of countries. Displaying epidemiological status enables business organizations to continue their activities and ensure safety in public areas. Mobile application is integrated with the COVID-19 PCR testing portal. This allows rapid change of every citizen's display status based on laboratory test results. Primary healthcare has also undergone a number of changes within the frameworks of COVID-19 response measures. Today, PHC in Kazakhstan is organized at the level of the multidisciplinary team, consisting of a general practitioner and other specialists, including nurses, social workers, and psychologists. This ensures the continuity and the consistency of medical care at all stages of treatment. Even before the pandemic, we understood the importance of strengthening PHC through the introduction of multidisciplinary teams. Nurses, social workers, and psychologists working in the community help address a wider range of health problems, better reach vulnerable populations, and improve disease prevention and control. The existing structure of PHC teams allows us to form mobile multidisciplinary teams during the pandemic. Overall, more than 3,500 mobile teams were formed during the pandemic, which brought services even closer to the population, including PCR testing and drug delivery free of charge. In particular, at the medical districts, we carry our active dynamic monitoring of risk groups patients using remote medical services, many audio and video consultations. For rural populations who live in remote areas, the medical services provided by the mobile medical complexes and the more than 2.5 million people covered by them. PHC doctors monitor patients with asymptomatic and mild forms of COVID-19 through develop checklists and rehabilitate patients with complications of COVID-19. Also, we provided access to medical care at the outpatient level, including outpatient drug provision, within the guaranteed volume of free medical care, mobile teams, call centers, multidisciplinary groups with specialists, remote medical services, and planned appointments. The efficient work of outpatient and emergency medical services made this possible to cope with the flow of urgent calls and the pronounced workloads of hospitals. To ensure social distancing in PHC organizations, patients' visits are booked online through the e-government portal, mobile application, a phone call to the registry, physician or nurse. Dear participant, let me once again express my gratitude to the regional director of Euro WHO, Mr. Kluge, and the head of the European Center of PHC in Almaty, Ms. Jacob, for constant support and constructive cooperation aimed at introducing modern recommendations and practices at the PHC level. Thank you very much for attention.
Thank you, Minister Tsoy. I believe the experience of Kazakhstan shows very well that there isn't a magic bullet to bridge access gaps, but we need a complex approach using a wide range of digital technologies, mobile solutions, and face-to-face consultations in facilities. With that, I'd like to move now to Greece. Greece has invested in primary healthcare reform prior to the pandemic, but as we know, implementation is often very challenging and takes longer than we expect. The pandemic proved to be an opportunity to catalyze and even accelerate some long-standing policy issues, especially in the area of implementing digital solutions in primary healthcare. Please share with us some of your experiences and also what opportunities and challenges you see in the future. Minister Plevris, I invite you to take the floor.
Thank you very much, and thank you very much for the invitation. Dear Dr. Kluge, ladies and gentlemen, honorable ministers, as I told yesterday, the reform of primary healthcare system is top priority for Greek government. The reform of health sector will be based on primary healthcare and the achievements of the COVID-19 pandemic effort. Our goal is to provide universal health coverage and access for all citizens to quality healthcare services. This reform will reorganize primary care services and lead to a new system of high-quality services with the participation and cooperation of the public and private sector. In this reform, digital transformation is very important. To your question, we all agree that the innovation in the model of the care system can only be achieved through digital technologies for health. What we have done, the e-prescription system. The e-prescription system for doctors was one of the reforms in Greece since 2012 during the economic crisis, aiming to reduce costs. And that was a great reform for Greek healthcare system. And we have a lot of experience of e-prescriptions. What we have to do now, digital technologies for health will include the following areas. First, access to e-medical record and its health data by the patients, the family doctor, and the training physician. Second, all health professionals who are certified and authorized users of the electronic prescription system will be able to register in the EMR system all the information resulting from the examination or visit of the patients. Third, interoperability of EMR with applications such as patient registers, medical certificates and reports. And fourth, telemedicine and teleconsultations. We have a lot of work to do. We have experience through the COVID. Digital transformation of healthcare system and of primary healthcare is the only way, and that is the first priority for my government. Thank you very much.
Thank you very much, Minister Plevris, for this intervention. And the Greek example shows very well that it's very important to consider not only specific digital solutions, but the health system enablers that need to be in place to make them work. And with that, I would now like to go to Denmark, because if we talk digital technologies, digital solutions, we must talk about digital health literacy for the population and digital competencies for health workers. Denmark has been a leader in implementing digital technologies in primary healthcare. As many countries are accelerating the adoption of such tools, what recommendations do you have for them? And what are your considerations for opportunities and challenges for the future? Director General Broström, the floor is yours.
Thank you very much. And it's a great pleasure for me to participate in this panel. Regional Director, Ministers, honored colleagues. Strong primary health care is certainly a key to universal health coverage. I think that is true for any country on the globe, certainly also in Denmark. And I think we've all seen the great importance of PHC during this COVID-19 pandemic. During the pandemic, we were forced in this country to make very radical reorganizations of our healthcare systems, especially in PHC. And we had to do these reorganizations within a couple of days or a couple of weeks. One of the reasons was that many of our family doctors are sitting in small crowded offices, and we had to basically divert all patients with upper respiratory symptoms into other fields of healthcare system. And we also had to very strictly prioritize patients with physical access to healthcare system. In that situation, we were able to utilize proactively a lot of digital solutions. One of the digital solutions that we utilized early in the pandemic was a smartphone app that is freely downloadable for all citizens in the country. It's also free of charge. And in this smartphone app, and I'm showing you here my app, which I just logged onto with my family doctor, I could during the pandemic have video consultations with my doctor. So that was a way of ensuring access to high quality healthcare without compromising the epidemic. So what are some of the reasons why we managed to achieve this in Denmark and that we have a very high digital literacy? One of the points I would like to highlight is, first of all, that we have a society that is already broadly digitalized, not only in healthcare. So most of the citizenry is already used to having electronic communication from the government, and also smartphone and technology like this is widely accessible. We managed to have a couple of smartphone apps in the healthcare field that were downloaded by most of the adult population during the epidemic. Secondly, I think a strong backbone of health registries with a very high confidence among citizens in using these health registries, I think is also crucial if you want to really escalate digital solutions in PHC. To ensure access and high digital literacy, I think the third point that I would like to highlight is that digital solutions need to be easy to use, easy to access, integrating them in well-known technologies like very basic smartphone apps that is very easy to use for everybody. And finally, I would also like to highlight that to ensure equity and equal access, I also do believe that solutions that are free of charge without high burdens in co-payment is also essential in this area. Thank you very much.
Thank you very much for sharing these experiences and especially considering some of the implementation issues. And this brings us to the close of our panel. I would like to thank you for sharing your thoughts and experiences with us. We have heard many important policy areas in this session so far to strengthen primary healthcare in the coming decade. And as we move forward, there will be undoubtedly many implementation challenges. However, I would still like to go away with a sense of optimism that has transpired from these 4 country cases or country experiences. We, from our side, we stand with you to implement these very important reform areas to get results. And as our regional director always reminds, we will be focusing not just on the what, but also on the how with pragmatism. Thank you, dear panelists. Thank you, everybody. Dear Chair, I pass the floor back to you.
Thank you, dear esteemed ministers and Director General, for this inspiring discussion, and thank you, Dr. Jakob, for your able and inspiring moderation. I now suggest and propose for a short break and hand over to Executive Director, Mr. Butler, for some housekeeping message. Mr. Butler, please.
Thank you very much.
So welcome back. As you noticed before the break, we had the results of the poll shown on the screen, and which were the suggestions to win were the financing, wasn't it, Dr. Muscat? And then multidisciplinary teams were then on the top of the list. So you really know what are the really important issues, but as we could see, all of them get votes a lot. So primary health care, to get it really work, you need a lot of dimensions to work then together. So thank you for your activities and doing this with us. I now open the discussion round, which will give delegates the opportunity to make statements on the thoughts shared in this session so far, the proposed working document and draft resolution. I now give the floor to the delegates. So do we have the list for delegates who would like to speak here? Let me see. Here. We begin with Slovenia on behalf of the EU, and then followed by Turkey and Azerbaijan. So Slovenia, the floor is yours.
Thank you, Chair. Director General, Regional Director, Excellencies, ladies and gentlemen. I have the honor to speak on behalf of the European Union and its member states on primary healthcare in the post-COVID-19 era. The candidate countries, Turkey and Republic of North Macedonia, Montenegro and Albania, as well as Ukraine, the Republic of Moldova and Armenia, align themselves with this statement. The core of European program of work, leaving no one behind, is of high importance for the EU and its member states. As outlined in the joint statement of the European Commission and the WHO Regional Office for Europe in 2020, the European Union and its member states and the WHO Regional Office for Europe share a common ambition to achieve the highest level of health and health protection in line with the SDGs, in particular SDG 3. The European Union and its member states take note of the WHO Euro report RC71/9, realizing the potential of primary health care, lessons learned from the COVID-19 pandemic and implication for future directions in the WHO European region, and agree to its conclusion that the pandemic provides opportunities for learning and thus improving our primary health services. As stated in this report, primary healthcare is at the heart of the WHO European Programme of Work, a united action for better health that sets out a vision on how WHO can better support countries in meeting citizens' expectations regarding health and access to health services. COVID-19 has confirmed that resilient, comprehensive primary health services available in communities are one of the cornerstones of effective health service delivery by health systems, and we therefore support WHO Europe's continued efforts to support the countries of the region in the development and strengthening of these services, as laid out in the draft resolution contained in document RC71/conference paper/6. The European Union and its member states would like to underscore the dual importance of well-prepared and prioritized comprehensive primary services, preferably organized in the form of multidisciplinary teams for the provision of first-level health services, health promotion and disease prevention, including immunization, and for maintaining essential health services during the current prolonged epidemic situation, while contributing at the same time to the emergency response by testing, contact tracing, and managing mild and moderate cases. As the demand for health care is evolving rapidly in the WHO European region due to the population aging, the growing number of people living with one or more chronic conditions, and the consequences of COVID-19, the European health systems need to strengthen primary health care systems more than ever in order to provide high quality and comprehensive health services at the appropriate level to all groups of society, irrespective of socioeconomic conditions, with particular focus on the vulnerable groups. In view of frequently reported COVID-19 related disruptions of essential health services like preventive services, cancer screenings, early detection and management of cardiovascular conditions, diabetes, and time-sensitive acute conditions such as heart attack and stroke, we are facing the risk of deteriorations of key indicators and hence need to respond to this challenge by increasing health system investments, activation and optimization of health management tools like automated platforms and other advanced technical applications, while using all available options to unburden our healthcare facilities by keeping the number of COVID-19 cases as low as possible. Digitalization should not only be used to address service delivery per se. A major challenge in strengthening health systems and improving service delivery is to have up-to-date information on the capacity, performance, content, and use of health services, including personnel and commodities. In this regard, digital solution can provide completely new avenues for health system governance. Furthermore, we would like to underline the importance of continued efforts to increase health literacy throughout all societal and age groups, including risk awareness and accident prevention programs. Thank you very much.
Thank you, Slovenia. And I remind you that we follow the same approach as yesterday. We have here first the pre-established speakers list. And if you don't have a member state delegate your name on the list, we will then, after going through this list, then take the countries and delegates who would like to speak after that. And then we go on to hear the partners and also non-state actors. On my list is now Turkey, followed by Azerbaijan and Israel. So Turkey, the floor is yours.
Thank you, Chair. Firstly, I would like to thank the Secretariat for their dedicated and comprehensive work. As we all know, the COVID-19 pandemic has once again highlighted that PHC has a vital role in the health system to protect human life. COVID-19 pandemic imposed an most impact at PHC in all countries and required rapid response to meet the demands. We welcome the draft resolution on PHC healthcare. A resilient health system can only be established on the PHC. During the pandemic, PHC have faced a lot of risks caused by gaps in the health system. As Turkey, we have focused on how COVID-19 has influenced and changed the role of PHC. With the pandemic, the way PHC are provided has also changed and the countries adapted or redesigned their PHC organization to respond to the needs of the population. In this context, Turkey adopted different policies to reorganize and strengthen the response capacity of the first level of the care and ensure the cognitive of actions directed to other healthcare needs of the population. The care flow have been supported with digital health technologies due to long-running physical lockdowns throughout the pandemic period. Distinguished delegates, comprehensive, efficient, and accessible PHC have critical role to achieve health-related sustainable development goals. The most essential lesson learned from COVID-19 is that pandemic control hinges on rapid, effective, coordinated, and sustained pandemic response at local, national, and international levels. Thus, we support WHO's work regarding comprehensive and aligned health system-based approach to strengthening PHC. With this in mind, we support the resolution under this agenda item. I thank you.
Thank you, Turkey. And then we have next Azerbaijan, followed by Israel and Hungary. Azerbaijan, please.
Спасибо большое. Уважаемая госпожа председатель, уважаемые дамы и господа, уважаемые коллеги. Укрепление первичной медико-санитарной помощи, особенно во время пандемии COVID-19, является краеугольным камнем устойчивой системы здравоохранения, необходимой для достижения всеобщего охвата.
To ensure universal health care. When considering these issues with the experience in Azerbaijan, we need to point out that we have undertaken efficient reforms in the overall health system. Systemic reforms undertaken are reflected in optimizing the system on the basis of access to the necessary health care, piloting and stage-by-stage introduction of health insurance, improving the system for training of health staff, introducing their certification, and attracting various health staff and medical associations in these issues. We are ensuring universal health care for all, and we are coming against old issues in a number of regions in the country. We are undertaking events to improve access to primary health care. We're strengthening material and technical equipment and taking a number of other measures. At the same time, COVID-19 pandemic has once again confirmed the need to reassess the existing system of primary health care and to identify ways of strengthening and reacting to emergencies. As practice has shown, timely involvement of primary care in the context of the pandemic has made it possible to undertake actions to inform medical associations and services on suspected and confirmed cases of infections, and this in order to take the necessary measures and to trace and track those who have contact with infected persons and to have contact with the patients and those who are isolated at home. At the same time, we think that we need to set up a unified system for providing primary health care on the basis of accepted standards that will make it possible to improve the quality of the services provided, as well as to provide qualified treatment at all levels in the context of pandemic and also in the context of other emergencies, as well as as part of planned provision of medical care. Thank you for your attention.
Thank you, Azerbaijan. Israel is next, followed by Hungary and Federation. Israel, floor is yours.
Thank you, Honorable Chair, Ministers, Ambassadors, and colleagues. Of the many lessons we have learned throughout the COVID-19 pandemic, few are as important as the need for more flexible approaches to primary health care. The pandemic showed us all the strain emergencies can place on primary health care and how it can affect the population as a whole, but specifically the most vulnerable among us. In Israel, we expanded our primary health care options to include home care options, even for those infected with COVID-19. This system was critical to freeing up our hospitals and resources. The system improved our capacity to treat patients across the country. Within the field of primary medicine is the ever important preventative care. Preventative medicine and better NCD management is crucial to reducing the burden on primary and hospital systems and a key factor not only in preserving health and quality of life, but also for economic savings. The less money spent on preventable NCD management, the more money will need to be spent on acute care treatment. It is absolutely critical to integrate digital tools and services to ensure remote access and convenience for both healthcare providers and patients, to enable better services while maximizing efficiency of healthcare workforces. Digital tools can also stretch scarce resources, not only during emergencies, but even in routine times. And it is the first step in meeting the challenges of aging populations. Lastly, we observe the need for primary healthcare providers to understand the digital tools which are so critical to improving cross-sectoral care. Health education must integrate digital skills and knowledge of the primary care workforce, from EMTs, nurses, and midwives to physicians, surgeons, and administrators. Only when healthcare providers are equipped with the skills and tools to provide primary care through digital means will our systems be able to handle almost any challenge that comes our way. Thank you.
Thank you, Israel. I now give the floor to Hungary, followed by Russian Federation and Germany. Hungary, floor is yours. Could you please put your microphone on? We can't hear you.
Yeah. Thank you very much, Chair, and thanks for the reminder. Dear Regional Director, Chair, distinguished delegates, Hungary aligns itself with the EU joint statement. It's very important for us here to strengthen primary health care and also rely more and more on digital health solutions. In accordance to this, the Hungarian government decided before the pandemic already to strengthen primary health care with improvement in its infrastructure, equipment, and also strengthen the human resources part. When the pandemic arrived, and it had a very specific characteristics, and in the dynamics, the GPs faced the new challenges in that. First of all, the fear of the disease, and at the same time, the urge to defeat the disease. The solution to most of these challenges was the introduction of a new e-prescription system, which were facilitated by relatives and helpers, a new telephone consultation system, and the development of an interview protocol for GPs using these e-health solutions. Also, at the same time, we made available that doctors over the age of 65 cannot be present in the direct provision of care. So they provided telemedicine, but not direct care, which we ensure, and we are sure that it indeed digital health solutions saved lives, not only the lives of patients, but also those for caring for them in healthcare system. IT developments were done for ordering tests, and many of these developments kept in place after post-pandemic situations. There were important lessons in coordination. So during the pandemic, that was a lot more coordinated pattern used between the primary care people and the secondary solution. A major new role in the primary health doctors was that in fighting the disease, they did the biggest part of the vaccination program. More or less 4/5 of the total vaccinated people are vaccinated by their GPs. And as people are trusting GPs very much, that helped us to conduct a very successful vaccination campaign. The major step from starting the beginning of this year is that group practices is becoming a nationwide program, and the full support from the society and from the government, together with a very historical increase in the doctor's salary and people working with them and along them. This new development, working in group practices, is very welcomed in the people, and we trust that in this post-pandemic with COVID period, as we call it in Hungary, we still do not call it post-COVID. We learn to live with COVID. However, after this pandemic steps, we are sure that there is no doubt that the strong primary care is a key in the integrated healthcare system, and the Hungarian government is deeply committed to strengthen and further develop quality primary care. And therefore, in this post-COVID era, we are determined to continue our programs aiming at strengthening primary health care in Hungary, and we are happy to collaborate on this area with globally and with the global players. Thank you very much for your attention.
Thank you, Hungary. Next, Russian Federation, followed by Germany and Spain. Floor is yours, Russian Federation.
Уважаемые коллеги,
Distinguished colleagues, distinguished regional director, distinguished Madam Chair, I would like to thank the European Office for using the example of the Russian Federation for organizing the care during the pandemic. It's important, the importance of transformation of primary health care in the context of COVID-19 pandemic is of no doubt. Among the main challenges, we'd like to highlight the lack of a systemic approach in actions of countries in contact between patients and doctors, and the readiness for action in case of emergencies when the number of patients exceeds the possibilities of the state health system and is linked to risk to health. The pandemic has proven the importance of coordinated action, political guidance in developing unified strategic plans with regard to universal health coverage. In the context of the pandemic, health staff, the health system and its main chain and link play the most important role in eliminating the emergency and must have high potential in terms of fulfilling its task. It's important to initiate staff resources and train specialists and increase financial resources for health staff, in particular the health staff working in the area of primary health care, who are in the forefront of the actions to react to the pandemic. Health staff also play a vital role in providing understandable, reliable information for population, increasing health literacy, including when issues relate to vaccinations. It's important to train health staff for efficient communication. The Russian Federation, during the pandemic, has trained more than 1.5 million staff, or has provided further training for them in terms of timely reaction to the pandemic. In order to improve health services and access to medical staff during the pandemic, an important role is played by digital health care services. The Russian Federation supports the draft resolution, which stands ready to continue joint work, including as part of efforts to set up a system of national coordinators. Thank you.
Thank you. Thank you, Russian. I give the floor to Germany next, and followed by Spain and Finland. Germany, please.
Sehr geehrte Frau Vorsitzende,
Distinguished Chair, Germany associates itself with the EU statement delivered by Slovenia. Primary care is an important milestone for Germany in terms of UHC. The COVID-19 pandemic has worsened existing challenges. Germany welcomes the report in that it highlights the role played by GPs in this crisis.
Hervorgehoben werden. Daran anzuknüpfen und darauf
In addition, in order to strengthen primary healthcare, we believe that this is the right approach.
in Weiterentwicklung
So we can learn lessons from what has been done. I'd like to highlight 3 important points. First, we welcome the WHO approach to digital technology. Protection of personal data must be taken into account. Second, primary healthcare systems
hat großes Potenzial zur Prävention.
play a great role in immunization rollout.
Die Lehren der COVID-19
We have had a unique opportunity to undergo deep transformation thanks to the lessons learned from the COVID-19 crisis.
Ansatzes sowie die Ausarbeitung der internationalen Gesundheitsvorschriften voll und ganz.
And indeed, we can strengthen and enlarge international provisions on healthcare.
So dürfen wir andere Bereiche wie vor allem nicht übertragbare Krankheiten.
We must also look to other areas, not only COVID-19, but also non-transmissible illnesses.
Dicksten für Schmerzen, körperliche Einschränkungen und eine der größten Ausgaben im Gesundheitswesen sind. In diesem Zusammenhang sollten globale Strukturen und
Global structures
Gesellschaften
must also look to the challenges of an aging population as we adapt our policies. Given the increasing population,
Patentrezept gibt.
I should like to say that there's not one solution for all.
In den jeweiligen
Healthcare solutions must be adapted to national contexts and find their own way. The work program
Modellen der
can help us to develop suitable systems. Thank you very much for your attention.
Thank you. Next, Spain, followed by Finland and Kyrgyzstan. Spain,
Chair,
floor is yours.
Dear colleagues, Spain aligns with the European Union at its member state statement. My country supports the draft resolution realizing the potential of primary health care, lessons learned from the COVID-19 pandemic, and implication for future direction in the WHO European region. In Spain, we are going to continue our commitment to strengthen primary care, and to this end, the Spanish initiative to update are in line with the WHO proposals. The Ministry of Health approved in 2019 the Spanish Primary Health Care Strategy Framework, people-centered, integrated, and networked. We would be advocate for the importance of primary health care in relation to accessibility, continuity of care, management of chronic conditions, health promotion to respond efficiency and equity to any future emergency. Universal health primary health care has emerged as a cornerstone to respond efficiently and with equity to the COVID-19 pandemic, and we are convinced that this right will be crucial for future emergencies. Primary health care is a core component of strengthening preparedness and response mechanisms for future emergencies. Spanish primary health care has been key in the response to the pandemic, both in community surveillance as well as in the follow-up of contacts, clinical care of management of asymptomatic patients and mild COVID-19 cases. The pandemic has taught us that healthcare professionals are the major pillar of the healthcare system. Spain is working on adapting human resources to present and future needs and on strengthening its professional capacities. We hope the regional director could create a working group to develop metrics, either quantitative and qualitative, for monitoring of primary healthcare impact, performance, and capacity to accelerate improvement and identify proven policy options that can be shared among countries. In this sense, we formally request the regional director to develop a Spanish-focused case study to generate evidence on primary healthcare to policymakers and implementers. Thank you, Chair.
Thank you, Spain. I now give the floor to Finland, followed by Kyrgyzstan and Ukraine. Please, Finland.
Thank you very much, Madam Chair. Finland speaking on behalf of the Nordic countries, Finland, Denmark, Iceland, Norway, and Sweden, as well as Baltic countries, Estonia, Latvia, and Lithuania. We thank the Secretariat for the report and support. We thank the Secretariat for the report and support the adoption of the proposed resolution. The discussion is a timely reminder of how important primary health services are, not only in the health system, but for our broader society as well as our security. Health services in all member states have had a major role in responding to COVID pandemic. In many member states, the high workload and consequent resource constraints will continue during the post-pandemic period and have a negative long-term impact on access. Specialized health services have had to prioritize the provision of basic and intensive medical care for COVID patients. In many cases, elective treatments have had to be postponed, which has had the potential of increasing the burden of primary health services. Primary health services have been responsible, in addition to their normal work, for contact tracing, testing, and vaccinations. In many countries, this has resulted in longer waiting times and delays in access to needed health services, with a negative impact on health equity, in particular for vulnerable groups. Our countries strongly recommend to use the current momentum in the post-pandemic situation to strengthen the primary health services in order to efficiently address at the appropriate level of care the treatment depth accumulated during the pandemic, while increasing preparedness for similar and other adverse events. Integrated and comprehensive primary health services can become a cornerstone of all health service delivery when they provide the essential first-level health services, child and maternal, as well as sexual and reproductive health, mental health, oral health, health promotion, and disease prevention, including vaccination, as well as act as appropriate as a gatekeeper to secondary care. This requires sufficient number of competent multidisciplinary health professionals who are ready to new distribution of tasks and who are supported by adequate technologies and working conditions, innovative and effective service delivery models for patients with chronic diseases, development of remote services, continuous education, adequate remuneration, and as appropriate incentives. Social protection should guarantee the universal access to universal access to every health services. Many times the problems presented in primary health services benefit also from social services, which is why administrative and operative link between health and social is crucial when improving the health and well-being of the population. Important lesson of the pandemic is that all dimensions of health systems need strengthening, not only service delivery. We believe some level of centralization, national or lower level, according to country specificities, will contribute to sustainable and effective governance policy development, financing, access to health personnel, and to health commodities, as well as health monitoring and surveillance. We very much welcome the newly established special program on primary health care at WHO headquarter level. Regional implementation needs to be aligned with this major program. The pandemic provides us a momentum for strengthening when needed, and when needed, recognizing our health systems. Investing in primary health services is a pivotal way to achieve universal health coverage and to increase health equity and well-being for all in the society. We expect that the WHO and the regional office will provide member states with state-of-the-art technical advice in this work. Thank you very much.
Thank you, Finland. And next I give the floor to Kyrgyzstan, followed by Ukraine and Georgia. Please, Kyrgyzstan, the floor is yours.
Good afternoon, dear participants. Of such a high-level meeting, distinguished ministers of health, distinguished Director General of WHO, Dr. Tedros Adhanom Ghebreyesus, distinguished Dr. Hans Kluge. The COVID-19 pandemic highlighted the weaknesses of the healthcare system and showed that a more sustainable and quick response system is needed to prevent further pandemics. It highlighted the need for high-quality primary health care, which can ensure timely detection and meet the health needs of every person in society. In Kyrgyzstan, we noticed that a strong primary health care system that can detect the needs of all people in societies and meet these needs with the help of multi-profile groups, so multidisciplinary teams. They proved to be the most sustainable. We also saw how strong primary healthcare system teams could carry out two functions: combat COVID-19 pandemic and ensure the provision of main services. And Kyrgyzstan has a good basis for moving towards strong primary health care and achieving universal health coverage. Our country has architecture for broadening universal health coverage. For example, the state program for state guarantees, according to which citizens have access to free of charge health care, inpatient and outpatient care with reduced out-of-pocket costs. Groups of people who have higher expenses for healthcare treatment have the right to have their out-of-pocket costs for inpatient treatment covered or reduced. Our country also has a legal instrument for subsidizing costs for certain medication. Although these instruments ensure a stronger primary healthcare system and ensure a basis for universal healthcare, they need to be strengthened and improved. For this reason, Kyrgyzstan is taking very specific steps to strengthen its primary healthcare system. At present, the Ministry of Health and Social Development has taken steps to set up an interdisciplinary task force on primary health care with a mandate to develop and implement policies. This is critically vital for parent leadership and monitoring. The task force will focus inter alia on how to strengthen the program of state guarantees so that it can work on ensuring universal healthcare and universal primary care. The pandemic highlighted the need for close cooperation between PHC and UHC and social services, and the task force is working to bridge the gaps in this cooperation. Kyrgyzstan has an important advantage. The Ministry of Health and Social Development are joined together. This simplifies integration of social assistance and primary health care in resolving difficult health-related problems. We are working on broadening training and retraining of our medical staff. This is an important step in implementing our vision of primary health care. Kyrgyzstan has come up against a crisis in healthcare staff resources. We have very low number of of healthcare among all the Central Asian states. We're working on ensuring the relevant number of medical staff in the primary healthcare system, including GPs, nurses, social staff, and mental health care staff, depending on the future forecasts of needs. We need to ensure infrastructure, payment, and working context. In April last year, we increased the salaries for general practitioners and family doctors in particular. We're also regulating costs on medication so that we can reduce out-of-pocket costs for families. We recently adopted a law to regulate costs on medication. This was the first step in the right direction to improve financial protection for the healthcare services. We're implementing a national digital strategy that includes the digitalization of the healthcare sector. Kyrgyzstan has achieved progress in this regard. Our program, Taza.com, is a national program of digital transformation. It uses the capacity of the industry of this technology and digital infrastructure to improve the life of people, create new economic possibilities, and a strong society which is centered around humans as well as their potential and value. The sector of healthcare, for the first time, has now a Minister for Healthcare on digital issues. Once again, I'd like to thank you for this opportunity to speak at such a high-level meeting. I'd like to thank you for the time accorded to me. Thank you very much.
Thank you. I kindly remind you the timelines we have agreed on in the special rules of procedures, which says 3 minutes per national statement and 5 minutes for group statements. We have still a lot of to go on our list and handle, so please try to keep your statements on these time frameworks. Next, I have on my list Ukraine and Montenegro. So Ukraine, please, floor is yours.
Dear Madam Chairman, dear participants, Ukraine joins the statement of the European Union, which was voiced by Slovenia. We support the need to strengthen the role of primary health care, in particular to ensure universal access to health care. Ukraine is actively implementing digital healthcare solutions, including the ability to sign up for vaccination in advance. Our plans include the adoption of a strategy for the development of primary care, which will also include strengthening the integration of a wide range of services at different levels of care in order to apply optimal common roads of care, consistent with people's needs for health services and provide rational use of resources. Thank you.
Thank you, Ukraine. Now I give the floor to Georgia, followed by Montenegro and Austria. Please, Georgia.
Thank you, Chair. I'm pleased to have an opportunity to discuss fundamental health-related aspect, primary health care, as it represents the main mechanism for the initial response to health needs. Resilient primary health care is a solid foundation for individual health as well as country healthcare system sustainability on macro level. The current pandemic proves to be a good example of this. The pandemic has exposed inefficiencies of the fragmented system and highlighted the need for a coordinated and strengthened PHC system. Despite the fact that attention and resources of all countries across the globe are currently directed towards the pandemic, other challenges should not be neglected. Addressing these challenges is again within the capacity of primary health care. Non-communicable diseases and their complications have a negative impact on the quality of life and therefore are among top-of-mind concerns. Lessons learned from COVID-19 show a high level of vulnerability of the individuals with chronic to novel coronavirus infection, and unfortunately, the death toll is high as well. Consequently, we should make every effort to strengthen primary healthcare systems in our countries. It was repeatedly noted at previous WHO sessions that effective healthcare means accessible healthcare for most. Implementation of the slogan, "Leaving no one behind," should be started at the level of primary healthcare. Proper accessibility to primary healthcare services is of critical importance, especially for the population living in rural areas. Based on these very principles, several pivotal interventions were introduced in Georgia, which constituted a starting point for rehabilitation of the primary healthcare system being impaired through the years. Out of these interventions, I would like to emphasize the Universal Healthcare Program, which greatly contributed to increased accessibility to primary healthcare services and medicines for the treatment of chronic diseases. It is noteworthy that deliberations of the recent past have already been introduced into practice and became tangible. In 2019, we set a goal that primary healthcare would inevitably evolve with the introduction of modern technologies and provide the necessary services to more people, closer to their communities. The goal has already become a reality. Currently, we are embarking on a major digital health reform, implementing new telemedicine tools in the regions and building digital capacity in rural areas. The pandemic has vividly shown the importance of remote health services. Quality, accessible, effective primary health care represent the highest priority for Georgian healthcare system. Thank you for your attention.
Thank you, George. I have on my pre-established list now Montenegro, Austria, and Lithuania. Then have to speak, still raise your hand there on Zoom platform. I will close the member state list quite soon. So now first Montenegro, followed by Austria, and then Lithuania. Montenegro, do we have you there? Seems to be problems with connecting. So we will take now Austria. The floor is yours, Austria.
Thank you, Madam Chair. Dear colleagues, Austria fully aligns itself with the statement delivered by Slovenia on behalf of the European Union and its member states. Yes, the current the current crisis has shown that primary healthcare units. Who is speaking now, Montenegro or Austria?
Austria, if you then continue, because I already...
Madam Chair?
After that, Montenegro.
Okay, I'm continuing. The current crisis has shown that primary healthcare units are flexible enough and play a crucial role in tackling the pandemic while maintaining proper healthcare services. But Austria is facing an immense generational challenge in the primary health sector. Imagine by 2025, more than half of our general practitioners will be at least 65 years old and 2/3 by 2030. So the weakest link in an otherwise well-established and developed healthcare system is primary healthcare. Therefore, we already established in 2017 a new legal framework for primary healthcare, and we are in a continuous way to implement the new measures. Maybe I can point out to some interesting points for the colleagues. In cooperation with the European Commission's Technical Support Instrument, TSI, Austria has successfully introduced a startup initiative that guides young physicians and healthcare workers in establishing their primary healthcare units by offering helpful information through individual consultation concerning specific topics such as legal, economic, organizational, or infrastructure questions. The Primary Healthcare Information Hub enhances the attractiveness of working conditions, communication and information between healthcare professionals, patient organizations, education, science, the public administration, and other healthcare stakeholders. The crisis has also shown that cooperation, competence, Collegiality, communication and coordination in flexible units are crucial for an efficient and sustainable healthcare system and a proper contact to patients, especially in rural areas. Professional multidisciplinary networks are relevant. We experienced that newly established primary healthcare units in a team-based structure and the spatial possibility of units were more resilient and able to continue providing care and treatment for people directly affected by COVID-19, but also for patients that were in need for acute or long-term care due to other healthcare-related issues. Besides, primary healthcare providers are also actively involved in testing, tracking, and vaccinating as part of the pandemic control. So Austria is entering the next phase of primary healthcare reform within the context of the Framework of Recovery and Resilience Facility, RRF, of the European Commission. Austria aims to promote primary healthcare further by creating at least 60 new primary healthcare centers and networks, especially in the rural areas in the next 2 years. We will implement more than 100 projects in the fields of digital and spatial infrastructure, environmental and social sustainability, and promote training opportunities in primary healthcare. And the investment volume we have in hand for grants will succeed 100 million euros for the next years. Thank you very much.
Thank you, Austria. And then we have Montenegro and Lithuania, and then we have done our delegates list. So Montenegro, can we have your statement, please?
Excellencies, Regional Director, ladies and gentlemen, many times throughout this pandemic months, we have highlighted pandemic is a crisis, but also an opportunity to learn and build back better. We learned the role of primary health care is fundamental. We have seen what happens when resilient, high-quality primary health care is not in place. Not only do people face a deadly virus without frontline support, but they also suffer collateral damage to their health from a dramatic drop in access to availability of any demand for the essential health services they really own. Primary health care has had a dual role, and in Montenegro, as in many other countries, suffered immense pressure during COVID-19 pandemic. Namely, primary health care workers were not only at the front line fighting against the COVID-19 pandemic, playing a critical role in terms of management of asymptomatic and mild COVID-19 cases, helping in community surveillance, testing and contact tracing efforts, vaccination against COVID-19, but also tried not to fail in providing basic essential services. This crisis has exposed several gaps in our system and helped us to realize that consequences of not investing in primary health care will be long-lasting, and then descriptions in essential health services became an even bigger crisis than the outbreak itself. During the pandemic, our primary health care experienced a considerable increase in the overall burden, responsibilities, and workload for primary health professionals. We understood that rapid adoptions and transformation have no alternative, and then more investment and required in particular for better digital infrastructure to support multimodal delivery of patient cancer services, which would include face-to-face, mobile teams, and digital services. We need to invest and use digital platforms to introduce operational and effective healthcare quality assurance system, to strengthen virtual capacities for emergency response, including capacities for surveillance, first response, management of cases, rehabilitation, and follow-up, as we must enhance preparedness for potential future emergencies. for new and better competencies and skills with a particular focus on management of chronic conditions and delivery of mental health services. Strengthening capacities for effective management of primary health care performance by data collection mechanics, ensuring analysis of performance, developing performance, etc. If we want to have a strong primary health care able to protect communities from the next global health threat and set the world on track to achieve health for all, the country partners and donors must invest more in primary health care so people can access affordable and high quality care no matter where they live, no matter the circumstance. Generate and use more and better data to help policy makers identify, understanding and target weaknesses in health system long before the next emergency hits. Protect and support primary healthcare workers as the backbone of strong health system, ensuring they have the tools and competencies they need to prevent future disease outbreaks and provide access to essential services. As the world directs its resources and attention towards ending the health and social crisis created by COVID-19, it is critical we all maximize the investment by prioritizing primary health centers as the foundation of a healthier, more equitable and safer future for all. Having said this, I would like to express special appreciation to Director Kluge and his team for dedication and efforts in organizing well-structured country consultations during the year. Results of these deliberations have been carefully crafted and translated into the quality working document shared with us that sets out a proposed way forward to realize the potential of primary health care and leave no one behind in line with the spirit of the European Programme of Work. On behalf of Montenegro, I would like to express full support for the proposed draft resolution. Thank you very much. Thank you all.
Thank you, Montenegro. And next I give the floor to Lithuania, and after that we go to the statements from our international organizations. Lithuania, the floor is yours.
Thank you, Chair. Dear colleagues, Lithuania fully aligns with the statement on behalf of EU and its member states. We note that the primary healthcare services are essential to combat the COVID-19 pandemic and other health emergencies, and therefore it is necessary to improve accessibility, quality, and affordability of primary outpatient health care and to increase health resilience to threats. Close cooperation between family doctors teams providing primary outpatient services with primary mental health and dental care and integration with public health and social services is essential for this. Multidisciplinary teams for primary outpatient services are very important, where the case manager should also provide services. The provision of innovative and effective service delivery models, especially for patients with multimorbidity, would significantly improve the quality of services. We note that it is very useful to share good practices and success stories on how to strengthen primary health care to help respond to COVID-19 and increase the resilience of health system to threats. One of Lithuanians' good practices during the pandemic is development of remote consultations. The need for remote consultation has increased significantly, and it's improved the accessibility of primary healthcare services. We note that the sustainability of remote consultations should be ensured in primary health care in the future. We call for the future adoption of digital solutions in primary healthcare and to increase individuals' health literacy. We thank the Secretariat for the report and the proposed draft resolution, which we are happy to support. Thank you.
Thank you, Lithuania. We now continue to the international partners, and the Secretariat has received requests from following partner organizations to take the floor. We begin the statement from OECD, followed by International Organization of Migration, and after that, Northern Dimension Partnership in Public Health and Social Well-being. So, OECD, floor is yours.
Thank you very much, Madam Chair, WHO colleagues, and distinguished guests. Much policy attention during the COVID-19 response had been on pandemic supplies and hospital capacities, but some initial difficulties to see primary care as central to addressing the pandemic slowed down the effectiveness of the response and triggered disruptions to routine care in many countries. Many patients, especially the most vulnerable, experienced delays in cancer and cardiovascular disease prevention, screening, diagnosis, and follow-up care, as we will show in our forthcoming flagship publication, Health at a Glance, in November. High-quality primary care has huge potential to address all care needs, and the cost of providing primary care is relatively low, and high-performing primary care reduces the need for more costly interventions. However, across countries, only 13% of total health spending is devoted to primary health care. Strong primary care requires, therefore, better investments, and let me focus on 3 priorities from our perspective. First, there is a need to invest in training more health workers with the skills needed for the future. Generalists make up less than 1/3 of all physicians across OECD countries, and their share has been declining over time. At global level, we are still a long way away from addressing the shortfall of 18 million healthcare workers by 2030. And besides training more, new and flexible models of primary care that leverage telehealth and encourage innovative roles for pharmacists and other health professionals are necessary. Second, and strong primary care requires investing in performance measurements. There are too few efforts, both at national and international level, to measure the outcomes of primary care, with most data concentrating on inputs and processes of care. Shifting the focus to health outcomes, quality of life, and patient experiences is a must for stronger primary care. To help this shift, the OECD Paris survey is collecting a new set of internationally comparable measures on outcomes and experiences with primary health care among people with chronic conditions. And third and last, we need to encourage closer integration across primary care and other parts of the healthcare system. Critical is the ability to integrate data across the system and strengthen information systems. A smarter use of routine and administrative health data linked at the individual level and spanning across the health system will improve real-time surveillance and ensure that patients receive the right care at the right time. These investments have important returns, both in terms of health outcomes, but also for each dollar invested in this digital transformation of healthcare, we have estimated that up to $3 can be expected in direct economic benefits for society as a whole. Thank you very much, Madam Chair.
Thank you. And next, International Organization for Migration, please.
Distinguished Regional Director, Excellencies, Ministers of Health, Delegates and Partners, IOM acknowledges the importance of the working document on realizing the potential of primary health care in post-COVID-19 era for future directions in the WHO European region. I deliver this statement today on behalf of the 2 IOM regional offices which cover the WHO European region. Human mobility is inextricably linked with sustainable development. This is recognized in the 2030 Agenda for Sustainable Development. We are reliant on the movement of people for our health, our food, and our socio-economic well-being at large. Due to COVID-19, the situation of people on the move, including migrants and their host communities, has been deteriorating. The pandemic has exacerbated pre-existing inequalities and discrimination faced by migrants and displaced persons in situations of vulnerability. As we address COVID-19, migrants have been on the forefront of the response to the pandemic, taking personal risks for everyone, including their host communities. We need to acknowledge the essential contributions across many critical sectors: health, food, transport, research, hygiene, and others. And now we need to ensure that migrants can continue to play this important role in our societies. The pandemic has also highlighted more than ever the need for countries to have inclusive health systems. It is critical that all communities have access to healthcare so that no one is left behind. As part of the universal health coverage pillars, IOM emphasizes the importance of equitable access to primary healthcare as a cornerstone of guarantee the well-being of everyone. Primary healthcare is the first point of contact and access for migrants, refugees, and other people on the move with health needs. It is critical to strengthen collaborations with governments and partners to ensure timely information that is linguistically appropriate to allow continuity of access to health services, including across borders. We have seen that this has been especially important in the fight against COVID-19 and other diseases. We acknowledge WHO's call for action to the G20 to meet the COVID-19 pledges, support regional vaccine manufacturing to reach the poorest countries. Decisions on distribution should be made based on public health principles and in line with international recommendations on prioritization. COVAX and other initiatives are set up precisely for this purpose. I am grateful for the leadership shown by our partners in WHO and in Gavi. IOM is honored to take part in these efforts. I would like to take this opportunity to call on governments to consider including all migrants present in their territories, regardless of their status, in their national vaccination efforts. IOM health teams are well prepared to collaborate with WHO, governments, and other key partners to reach these vulnerable groups with COVID-19 vaccines when needed. As long as there is active COVID-19 transmission anywhere, there will be a risk of transmission everywhere. The COVID-19 efforts need to be closely connected with migration governance. Last year, WHO joined the Executive Committee of the United Nations Network on Migration. IOM, as the coordinator of the network, cannot emphasize enough how grateful it is to WHO for engaging in this critical convening platform aiming at leaving no migrant behind. I assure you that we have committed to our partnership with the WHO European Regional Office and its European Programme of Work for 2020 to 2025, United Actions for Better Healthcare in Europe, to support the member states, including migration health at primary healthcare level. Thank you for the opportunity to address you, and I wish you a very productive discussion and deliberations. Thanks.
Thank you, IOM. And now on Northern Dimension Partnership on Public Health and Social Well-being, the floor is yours now, please.
Thank you, Madam Chair, for the floor. Dear Regional Director, distinguished delegates, ladies and gentlemen, the Northern Dimension Partnership in Public Health and Social Well-being fully agrees that primary health care is the cornerstone of the sustainable health and social systems needed for attaining the SDGs. Our expert group on primary health care, which has been operational for more than a decade, is acting as a platform for exchanging best practices and creating new knowledge about the primary healthcare systems in the Northern Dimension area. WHO and its Almaty and Moscow offices are effectively participating in the expert group work, and we are grateful for the support and active engagement. Currently, our experts have embarked on a study aiming to identify and analyze the barriers for provision of remote health and social services in our countries. Digitalization of health and social services must be inclusive and shall not lead to more inequalities. People who need care most, such as older people, people with multimorbidities, people with disabilities, and people of low income, are those who are at least likely to seek care online. Thus, it is crucial to listen to the users, engage and understand them, and co-design the digital solutions together, making extra effort to empower and involve in a meaningful way people from marginalized and vulnerable groups. We also firmly believe in a person-centered approach. For example, older people are often treated as a homogeneous group, which they, of course, are not. Just last week, our partnership organized an inspiring policy lab aimed to prioritize actions that we need to undertake to promote healthy and active aging. The activity most prioritized by the participants was a mapping of the health and social care needs of older people based on the different life paths they are, rather than a simplistic division based solely on age. Another idea that was often expressed during the policy lab was an invitation to fundamentally and systematically revise the modes of thinking and stepping out of silos towards a co-creation that is inclusive across sectors and societies. We will pay particular attention that in our organization we practice what we preach and are inclusive in our work when discussing and proposing solutions aimed to strengthen primary health care. Dear Regional Director, Dr. Kluge, we would like to assure that the NDPHS is committed to support the WHO by enhancing partnerships at the regional level and by facilitating the exchange of practical country experiences and the cross-country dialogue, and by channeling the knowledge to key actors to make progress in health and social well-being in the region. With this, I would like to thank you for your attention.
Thank you. And before I close the list of speakers from partner organizations, may I ask if any other delegates wish to speak? I see none. So we are lagging behind our schedule, but I would like to give at least to one non-state actor possibility to speak here. The Secretariat has got and received requests from a number of non-state actors to take the floor, and we have also asked them to give joint statements, and we have here the list which we have got, but we go now and I would like to give the floor to the one where we have quite many actors jointly. So Maria van der Muizenberg from EFPC, could you please give your statement, joint statement?
Thank you, dear Chair, President, Regional Director, Ministers, Delegates and colleagues. On behalf of many non-state actors and the European Forum for Primary Care members, we would like to acknowledge the relevance of the proposed resolution realizing the potential of primary healthcare and its policy considerations, and of this special session on primary healthcare. The COVID-19 pandemic has disrupted health and social care systems on a global scale. The pandemic has once again proven that strong primary care contributes to lower hospital care burden, to effective epidemic surveillance, and to the delivery of at-home care tailored to the people's needs. In the current environment, member states have a responsibility to invest in health systems that drive health promotion and prevention through primary health care, as reaffirmed in the Astana Declaration and in line with the Sustainable Development Goals. To realize these commitments and to build a sustainable primary health care, strong global equity must be established. The undersigned non-state actors and EFPC members call upon member states in the European region to invest in the future sustainability of primary healthcare based on the following recommendations. 1. Optimize resource allocation and financing to allow reorganization of workload and patient flows while maintaining regular primary health care. Address inadequate personal protective equipment and staffing shortages. 2. Develop accessible and user-friendly digital health solutions, facilitate and increase access to healthcare services, and encourage self-management. 3. Provide psychosocial support for vulnerable populations such as older people, chronically ill, those requiring palliative care, low-income groups and ethnic minorities, as well as their caregivers, particularly women who have been disproportionately affected by the pandemic. 4. Co-create with the community readily understandable, culturally acceptable health communication and prevention tailored to their needs and engage and empower primary care professionals to this effect. 5. Enhance and expand interprofessional collaboration for the multidisciplinary teams. Support the development of health and literacy skills to navigate the complex landscape of emerging technologies, so that lessons learned present an opportunity to tackle future challenges, adopting efficient systems to swiftly respond and to deliver high quality, affordable, integrated, person-centered primary health care. Thank you very much.
Thank you. And I apologize that because of the time constraints, we can't now have the other non-state actors' joint statements here. But I would like to emphasize that non-state actors are very important partners for all of us in Europe and in the whole globe in each country. So we really respect the work you do. And as mentioned before, several NSAs have also submitted individual written and video statements, and you can see a list on screen. We showed you a list on screen also, and you are invited to consult them on the website of this regional committee. So as there have been a number of comments made on specific questions raised in the interventions, I will now ask the regional director if he may wish to take the floor. So Dr. Klug, you have the floor.
Thank you very much, Madam Executive President. Ladies and gentlemen, the past year and a half have been difficult and challenging for us all. Our social media feeds, TVs and radios have told a story of suffering, fear and uncertainty. Staying motivated and positive has often, truth to be told, been challenging. But when I hear, see and read about the amazing transformation that has taken place in our primary healthcare systems, I cannot otherwise than feel optimistic and encouraged. If we, driven by necessity, have witnessed such meaningful change during the pandemic itself, imagine what's in store within our grasp, what can be done in the future. The leadership you have demonstrated with your actions over the past year and a half motivates me. I am truly heartened by the commitment you have shown soon to consider passing the resolution. Rest assured that WHO Europe is more committed than ever to work with you and be your partner. As you heard yesterday, strengthening primary healthcare is the flagship of the flagships, because the pandemic has underlined the importance of sustained efforts to strengthen primary healthcare, so it becomes finally the cornerstone of health systems. This is in the spirit of the historic Alma Ata Declaration endorsed yet again in Astana. And the past year has only magnified the urgency of these commitments as well as our determination to live up to them. I have heard many of you speaking about an opportunity to build trust in the primary care system, not at least through the vaccination programs. The political premise of the EPW is about trust. We are already aligning our resources to make this happening and shift our focus to implementation and concrete results. Yesterday, in my talk, I was mentioning that the art of closing the implementation gap between our big ambitions and concrete results on the ground lays in tailoring good practices to national and local context. And thank you again so much, Dr. Alexey Vladimirovich Soy, Minister of Health of Kazakhstan, for giving us the resources to do so through the WHO European Center of Excellence on in Almaty. We will work on applying pandemic lessons to strengthen models of care in our region. And you mentioned here 2 points: to be delivered by a skilled health workforce and enabled by new digital tools. Austria, Dr. Clemens Auer, was mentioning a great example of attracting young professionals. I think this is key because we're all concerned. Will we attract more or less young professionals now due to the pandemic? And we need to offer the appropriate working condition and a good work-life balance, particularly for the female health workers. Digital tools, it's amazing what's happening already, to deliver integration of teams, but also coordination with specialized care, because also primary healthcare doesn't stand alone, is within the continuum of services. We have thought a lot, as you can imagine, about our comparative advantage in the field of digital health, because it's very crowded, and sometimes it's over-promising and under-delivering. So we thought a lot that WHO has a comparative advantage in the field of data privacy, because we work based on trust, digital health literacy, digital competencies of the health workforce, and using data to identify vulnerabilities. Remember, top recommendation of the Monti report, we have to measure who are we leaving behind in society. In many countries, we don't know who we are leaving behind, and then we cannot heal the fractures in society. We will work further on the primary healthcare performance monitoring, which was mentioned by Spain. I fully agree, this is critical. Already, there are core indicators in the EPW monitoring framework included, which is on the agenda of the Regional Committee, and we will work towards a regional version of the global monitoring framework. In that regard, I would like to reassure Norway that since the beginning, there is a very close partnership with the special program on PHC established at WHO headquarters, with a fully aligned work program and even already a range of joint products, where frankly speaking, the GDO and Almaty have been taking the lead. For example, a new multi-modality course on PHC with a global online and regional face-to-face model. With all of you, we aim to move this agenda forward, headed towards a future of thriving partnerships and solid foundations. And that's why the intervention of the OECD, IOM, the Northern Dimension Partnership, our friends of the European Forum on Primary Care, and all the NSAs is very, very crucial. We believe in the power of positive partnership. And thank you also to Dr. Anna Stavdal, who made the time. In fact, this is also a proof of our commitment. Dr. Anna Stavdal was one of the few Monti commissioners from the health sector. So from the very beginning, we asked Professor Monti to have a primary healthcare champion in the Monti Commission, the president-elect of WONCA. So thank you so much, Anna. You know about our commitment. During the pandemic, I have had an opportunity to pause and reflect on the many aspects and manifestations of solidarity. If you ask me, solidarity is now our common value, the glue that binds us together. We act on this value by strengthening primary healthcare, and there is no better example of solidarity than that shown by the health and care frontline professionals, who have worked incredibly hard since the onset of this pandemic and also not saved from burnout and we further need them. The courage, selfishness, and integrity you, health and social workers and frontline workers, have shown, the sacrifice you and your family have made, are a true inspiration to us all. Through united action, we will succeed in realizing the true potential of primary healthcare for better health. Thank you.
Thank you, Dr. Kluge, for your inspiring words and championing the cause of primary healthcare. To conclude agenda item 5, we can now consider adoption of the proposed draft resolution contained in EUR/RC71/ConfDoc/6, so draft resolution on realizing the potential of primary healthcare, lessons learned from the COVID-19 pandemic and implications for future directions in the WHO European region. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objection. The resolution is therefore adopted.